Hello.
Buenos dias, Lupita. How are you?
Good morning, good afternoon from the UK. Hello, darlings.
I
Clue.
I like the pink and the yellow with the sunflower in the back. It looks amazing. It looks really good.
It's all so random, it's untrue. Anyway, good morning, Diana. How are you today?
Good morning. I'm doing well because today I'm just really excited because our guest is going to bring more fire. I mean, if we have fizz and fire, I don't know how we can get any hotter, but we have the Feminine Flame MD here today.
Yeah, she
And
is
this
super
is
hot.
going to be amazing. So before we get started,
Yes.
if you're just tuning in, I'm Diana Londoño. I'm a urologist in Los Angeles, and I'm the founder of physiciancoachsupport.com. It's a free confidential platform where any physician can come and get support by a peer, one-on-one, who's also a certified life coach. So we are just here to support you 7 days a week via Zoom. So we're here for you. And really, the purpose of our podcast is always to bring positivity, light, enthusiasm. And we are so excited to learn about our bodies, learn about what menopause is. And so, this is what is for you to get knowledge. So, Nupi, tell them who you are and what you're all about.
Thanking you. So, I am Dr. Nupi, aka the Glitter Practitioner, hashtag Physessence, and I'm a family physician in the UK and also a spiritual and transformational life coach. And my passion is really helping others, be it my clients, be it patients, physicians, really showing them how to rebalance their health needs. And I guess the bottom line of what my whole program, Find Your Fizz and Flourish, really is about is what brought us two together and why we wanted to start this show is your needs matter. Full stop, end of. And it's reminding people how to value your own worth, own your needs, protect them, stand in your power, and live the life you were meant to. And that's exactly what the show is also all about. And I can't wait to bring our beautiful flower on. Let's just get her on.
Yes, yes,
Good
yes, yes.
excitement.
She is just amazing. And, she brought the fire this morning in the green room. And just so you know, Dr. Sorlie-Aguilar, she is from USC Keck School of Medicine, graduated and did her training at UCSF Fresno, where she really, for the past 16 plus years, have been taking care of all patients in primary care in the Los Angeles area. But she really got really focused on menopause, women's health, and she's going to tell us all about it. So let's bring her in because she's looking fabulous. And it's her birthday today. So have her come in.
Hello! Yay!
Oh, good morning. Hello.
Good morning, beautiful
Hello.
doctors. Oh my God. All this brilliance and beauty and smarts and fire and fizz. Love it. Love it.
I love it. I loved your voice. Do it again.
Oh, yes, this is
It's like
the
it's
best
like the freaking amazing Brady Bunch up here with these boxes. These little
right.
gorgeous, brilliant little heads.
And look, we are all in the.
No, I know. I'm wearing my vulva dress. It looks like a vulva. We're going to learn about the vulva because this is really important. We got to learn our anatomy. We've got, oh, there it is.
I love
So if
it.
you're watching on
Look
Spotify,
who else is wearing pink.
yeah, if you're watching this not live and not video, you got to put the video because we're going to learn anatomy. But please tell us why you got into this. I mean, why didn't you not focus on diabetes or dead feet or something else? Why menopause is so important? Because how many women does it affect and when is it going to affect us? Tell us more, and also really just what menopause is, because I think there's confusion of what it is. Let's start there perhaps.
So I'm going to get up close and personal to tell you this story because menopause is personal. So when I was 42, my periods were crazy and unpredictable and evasive. And I did not think much of it at first. I chalked it up to being a couple pounds overweight. And to be honest, when your periods don't show up, you really don't miss them, especially in your later years. But the year I turned 44, I stopped having my periods altogether. And then I started having hot flashes and night sweats. and I could not sleep to save my life. So I was tired, I was stressed, I was anxious, I was moody. I had no idea what was going on. Here I am, a female family doctor, and I did not realize I was suffering classic symptoms of menopause. I thought menopause was like for older women later. I knew it would come someday, but I thought I had plenty of time to plan for it. And I didn't know then, what I know now is that the normal age range for menopause is 45 to 55. And I was there a bit early, but guess what? She comes on her own time. She doesn't read the textbooks. She comes when she wants to come. And menopause is when a woman has been 12 months since her final menstrual period. So can you imagine a condition that impacts all women, half the world's population? Every last woman on earth will go through menopause, yet we're not adequately prepared for it. 1 billion women in the world and 50 million women in the US. That's why I went into menopause, because it is so far reaching and so important and so personal.
Of course, so many women, are going to suffer from this transition without knowing what to do, just suffer and think that it's okay to not sleep. It's okay to be moody. And they're just going to probably think, oh, here's your depression pill and go on your way and get out of here. But it's so important to tell women that the range, like you said, is wide. It could be like 45 to 55. It could be any time. And it really means that for one whole year, you're not going to have that period.
Yeah.
That's when you know. And then if it's been a 1 year, you haven't had your period, but then you start bleeding after, that's really important time to go to your doctor right away, because it's never normal to have what's called postmenopausal bleeding. So
Yes.
really important.
And it doesn't just impact our bleeding pattern or our vulvas and vaginas. It impacts our whole body. And we deserve to be empowered to know how to educate ourselves so that we're ready, because it's critical. This is our body. We've just got one this time around. So we need to take care of her. And we need to get informed about exactly how it's going to impact us. And that's why I was so excited to bring my friend here.
Tell us about your friend. Oh, I love that friend. Tell us.
This gorgeous gal. Everyone knows and has heard of the vagina, but do you know where your vulva is? This is your vulva. This is what a lot of people call the vagina, but this is actually the vulva. The vagina is the inside, the birth canal, or where we have penetrative sex, but the vulva is the correct name. Let's call her by her name for the outside of the female anatomy that includes the labia, the outer labia, the inner labia, the clitoral hood, the clitoris underneath, the pleasure center, the urethra where we pee from, and the vaginal opening. This is the vulva, and this is one of the main places where we start to feel changes in menopause. And that's called genital urinary syndrome of menopause. And I don't know, I had never really heard much about it before I got there myself.
Lupita, how are you doing? Okay, so we have a little bit issue with Nupi. We shall get on soon. But yeah, it's so important to show the anatomy, because people think the vagina is just everywhere on the outside. And the vagina, like you said, is just the canal where the babies come out, or where the penis will, come in for sex. But the outside is where all these changes are going to happen, and they're going to affect us. So tell us what the symptoms are like in your whole body. And also we'll talk about the localized in the vulva, because I think that people may not know about the common, not common symptoms, and also the ones that affect around the urethra where you pee out of, and your bladder symptoms and all that. So start maybe with the whole body. You talked about some of the ones you were experiencing. You couldn't sleep, you had the hot flashes, you just felt anxious. Are there other ones that people need to kind of be aware of that they may experience as they go through this transition?
Basically, it's not about where on your body do you feel the impacts of menopause. It's like this. You feel the impacts of menopause on your whole body, because there's estrogen receptors in your whole body, in your brain, in your heart, in your bones, in your skin, everywhere, your vulva, your bladder, everywhere. There is no place where there is no impact of living in menopause, which is a low estrogen state. Before menopause, our ovaries produce plentiful estradiol, natural estradiol, which is the estrogen that we produce. And after menopause, it drops precipitously, it drops. And so you can imagine all the places our beautiful female hormone estradiol functioned in our body. And then after menopause, it's gone. It's minuscule. It's
Correct.
so small amounts. So all the things that estradiol did for us, fortify our genital area, our urethral area, help our mood, help strengthen our bones, our hair, our skin, all of those things, it's gone. So it could impact every part of our body. Women in menopause suffer from osteoporosis, which is thin bones. They suffer from mood issues, anxiety and stress and depression. They suffer hot flashes and night sweats and insomnia and chronic fatigue. They can feel joint pain and arthritis. Literally, there is no place that we do not feel the impact of menopause.
Yeah, that's so important. Some people just think, yeah, it's just a hot flash and that's it. But it could be all, some, or none, or very mild perhaps. But it is going to impact your whole body. It's so important to realize how it's going to impact you. And then let's talk a little bit more about, like around the urethra in this vulva area. What happens in the vulva? Because I think women, perhaps if they're not as frequently sexually active or at all, in their older years, then they think like, oh, there's no baby coming out, or I'm not having sex, so I don't even have to look at it, take care of it, or worry about it. But it's going to really affect how the tissue changes. So tell us about that tissue in the vulva, what happens to it. And then we'll talk about what to do to fix it and make it better. But what's going to happen really in that area? And what are we going to feel?
So I would say this, if any woman is listening to this and you don't remember anything else from what we talk about today, remember this. Vaginal dryness, burning, pain with sex, frequency of urination, and incontinence in menopause is not a normal part of aging. We do not have to take that lying down. We have safe, effective treatments for it. So because estrogen supports the vaginal and urethral tissue, the labia, the urethra, it fortifies them, it gives them plenty of circulation, plenty of innervation, plenty of lubrication. So when you don't have it, what do you have? You have dryness, you have burning, you have pain with sex, you have frequent peeing, you have sneezing and peeing, and you don't have support of the genital urinary. They call it genital urinary syndrome of menopause, which is a fancy way of saying vaginal dryness, burning, and incontinence. And there's safe, effective treatment for it. And most women don't know, I didn't know before, but low-dose topical vaginal estradiol is a simple prescription that we can get from our primary doctor or our OB-GYN or our urologist like Dr. Diana. And it's low dose. A woman can apply a pea-size amount to her finger twice a week just to the urethra area, just inside the inner labia, the clitoral area. And she could use that safely from menopause for her whole life to support her vulva and vaginal and urethral tissue. It's so simple. It is so simple and so safe because it's topical and because it's low dose. It's not systemically absorbed. So almost every single woman who's menopausal could safely use this her whole life for those symptoms and to support her tissues. So that's my huge take home. If a woman doesn't remember anything else, don't take it lying down, sister. Take care of your vulva. She's taking care of us. We can show her some gratitude and give the girl a little estradiol.
I love it. I absolutely
Take care of this
love
girl.
it. Can you hear me now? Quickly, perfect, great stuff. I love this. And actually, when I was listening, it's the genital urinary symptoms, actually, the itching, the pain, the dryness, that has it sounds, oh, it's just a bit of itch, dryness. No, it's not. It totally interrupts your sleep patterns. It's painful. I think it's actually some of the symptoms that get so misunderstood and mistaken for yeast or thrush The number of women I used to see in general practice with these symptoms, and you look at their age, you have a chat, and I'm like, oh, honey, try this instead. This is going to change your life. But it's really has such a knock-on effect, because when it starts impairing your sleep, your quality of sleep, awful.
Yeah, I mean, really, any woman that is around menopause or menopausal should be on this. And I tell my patients, just like you put your face cream, your fancy face cream at night, you also want to put your cream there, because if you don't moisturize that, or your legs, they're going to get crackly and dry, and it itches and it burns, because the urine is acidic. When it touches that tissue, it burns. And then people think it's an infection. And many times it's not a urine infection. It is just the urine touching the dried, raw skin. And so it's going to feel much better. And also, it will put you at risk for true urinary tract infections.
Yes.
As a urologist, I see this all the time. Recurrent infections, I can't get rid of them. Well, the number one thing you have to do is start, either you do a cream, there's the estrogen rings. I mean, there's many ways to put, the estrogen back into the area locally, but you got to start that to prevent infections and kind of nip it at the butt, because if you get a really bad infection, you're going to end up in the ICU and you could die from a urine infection. It can really be real. So start something to prevent. I like to do it every night, because I think it's like your face cream. If you don't do it every night, you forget. Many people do 3 times a week. Whatever is something you're going to do and remember to do, that's fine. It's very safe. It's a pea size. So I just love that. Yes, remember this important thing, because that is really going to impact your quality of your life.
Yes.
And your risk for infections and
Yes.
and pain with sex and all this stuff.
Yes, estradiol, generic. In the UK, the estradiol low-dose tablets over the counter, if we could believe that, that's how safe it is. It's not over the counter in the US yet, but in the UK, the low-dose estradiol 10 microgram tablet, which can be inserted into the vagina, is over the counter. That's how safe it is. And I'm hoping we'll catch up in the States. We're not there yet, but the cream can easily be prescribed by any primary care doctor. We just have to ask for it, because you're right. We get told, oh, it's yeast, or oh, it's a little dryness, or go get some KY jelly, which is great. You do need those treatments. But if you don't treat the root of the problem, which is the lack of estradiol, the lack of natural estrogen, then you're just putting Band-Aid on the wound. You're not fixing the root issue. And it's so easy, and it's so easy for the doctor to prescribe, and it's so simple for us to ask for, and it's a game changer for our genital health. And along those lines, just what you were talking about earlier, Diana, about the hot flashes, it is not just a hot flash. It's a news flash. It is a news flash from this brilliant women's wise body. And that hot flash is saying, hey, check it out. Your whole body's changing. There's a lot going on in here. Pay attention to me. And I'm not even going to let you sleep until you pay attention to me. It is so important. I think sometimes women go to the doctor and they say, I'm having hot flashes and I'm having night sweats. And they're like, yeah, here's some sleeping pills, or here's a blood pressure pill, or here's an antidepressant, because I bet you're moody too, which those things help a little bit. But again, they're not getting to the root of the issue of why we're having the hot flashes and night sweats. And can you imagine? Less than 10% of women in the US, at least, are taking menopausal hormone therapy for their menopause symptoms, even though we have FDA approved medication that is known to be safe and effective for that. In America, we have the North America Menopause Society, which is the governing body on all things menopause. They compile all the evidence and the research, and they put out a position statement. And this year, 2022, they put out a hormone therapy position statement, and they said, for women within 10 years of their last period or less than the age of 60, menopausal hormone therapy, the benefits outweigh the risk, and it is effective, evidence-based treatment for menopausal hormone hot flashes and night sweats. And genital urinary syndrome of menopause. So we have a governing body saying that the benefits outweigh the risks in this population. We have the symptoms, we have the effective treatment, yet we have less than 10% of women taking it. It makes no sense. And I think it's because we don't know, we're not empowered, we're not informed, we're scared. We read big headlines that say it's so dangerous. And of course, every treatment has risks and benefits, everything, antidepressants, Viagra, blood pressure medicine, everything has risk. And here we have something so vital to our woman's body, so vital to our sexuality, our sensuality, our bone health, our brain health, our mood, and we're scared off of taking it, or we're sort of dismissed at the doctor's office sometimes. And we don't have to take that lying down. We can get empowered and we can be proactive, and we can operate off of wisdom and awareness, not out of fear.
Brilliant. Oh, I love that. Fantastic. Do you know what I liked the way you reframed hot flash to news flash, and it's everything. Your body talks to you, and it's being in tune with your body's needs.
Yes.
And every time anybody out there has a hot flash, bam, reframe it. News flash, news flash. This is what you need. Your body is missing something. Fantastic. I love that reframe.
Absolutely. And I think some women are so scared. They've heard hormones are dangerous. They've heard a headline, hormones will kill you, hormones will cause cancer. And there's a lot of nuance to it, but there's one overarching fact that is true. Women who take menopausal hormone therapy, get this, I bet you haven't heard this, live on average 3 years longer than women who don't. That means they have less mortality, a decrease in all causes of death over their sisters who don't take menopausal hormone therapy. But where have you heard that? Nowhere. It's in the literature, it's written down in the fine print, but no one tells us that. And that's huge. If we have something that can treat our symptoms and we get to live longer and with a better quality of life, but no one's telling us, I'm telling you right now, we are telling you right now, it takes a little effort to get informed. It takes a little time on our part, but that's why I'm so passionate about this, because it's so important. Imagine if you were a woman in menopause, and unlike me, who was sort of like taken out of left field by it, imagine if you knew what was coming, you knew what would help you, you knew what to ask your doctor for, you knew the risk, you knew the benefits, and you could enter into menopause with grace and ease and your sensuality and your energy and your sleep. Imagine how different it would be for all women. And we can do that. We can get informed. We can enter with grace and ease and joy and radiance. We just need to invest a little time to get informed. That's why I made my website, Feminine Flame MD. That's why I made my free video guide downloads. That's why I made the Menopause Mastery course that I'd love for women to sign up and get on the wait list for. I can show you how to enter menopause with confidence, being well informed. And if you decide to take hormones, great. And if you decide not to take hormones, that's your personal decision, but you made the decision. You didn't fall into it by default. You weren't brushed aside at the doctor's office. You made that decision. And as women, we're brilliant. We raise families. We have brilliant jobs. We go through med school. We're lawyers. We're doctors. We're teachers. We're mamas. We can make this decision too. We deserve to have our health and our future and our vitality in our own hands, and we can do it together.
Amen, sister.
Yeah. Yeah.
Viva la vulva.
Viva la vulva. Woo, 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 woo.
And she wore pink too.
It's pussy power. Oh, am I allowed to say that?
Yes, of course. Yes, of
Viva la
course.
vulva? What'd she say?
It's pussy power.
Yes, that's another name. I love vulva. Vulva.
You can choose
Vulva.
if you want to or not, and you made the decision. And maybe the symptoms are not so overwhelming for you that you don't want to do that systemic replacement. But you make that decision. And if not, again, like you said earlier, the bare minimum is to put the cream or any topical or ring around the vulva and urethra. We're going to put it around the urethra for the localized symptoms, because it could be really uncomfortable to kind of like sit and feel it's so dry like sandpaper that you almost don't even want to sit down, and it gets itchy and red. So the minimum you can do is at least that. And 1 year's worth of the cream is the same as one pill that you take by mouth. So the levels are so low. And
Yes.
what scares women is they go to the pharmacy, they pick it up, and the label says you're going to get all kinds of cancer. And it's absolutely outdated, ridiculous.
Not
And I
true.
would never prescribe it if I knew it was going to cause cancer. So people
No.
are afraid. And when they're afraid, like you said, they're going to be like, oh no, I'm not going to do that. I'm so afraid I'm going to die. And then don't take action from fear. But when you
Yes.
take action from love of how you're going to feel better, you're going to be nicer around your family because you're not cranky and uncomfortable. Take
Yes.
that decision from a place of love, and
Yes.
it's going to be much different. So I really love that you talked about when we act from fear, yeah, we're not going to do anything really. And we're going to be
Yes.
suffering and we're going to be uncomfortable.
And as far as the estradiol cream, the low dose is concerned, it's never too late. If you're 60, if you're 70, if you're 80 and you're out there and you're hearing this, it is never too late to use that. Like you said, it's not systemically absorbed. It does not raise your blood levels of estrogen. It is safe for almost every menopausal woman on the planet. Ask your GP like Dr. Nupi, or urologist like Dr. Diana, or your FP like Dr. Victoria, and we can prescribe that. And if your doctor won't, you need to keep asking. Don't give up, because it's safe. I know there's some doctors that aren't up to date on the latest, even though the evidence has been out there. Keep asking. Don't get shut down. Don't get turned away. Your vulva deserves it.
And there were some questions in the chat, and thank you for everybody tuning in. Marina Gonzalez gave you a happy birthday shout out. We have Ileana, we have Kathy Chin. We have amazing women here just getting that knowledge that's so important. So for the US, and I know it's different in the UK because a lot of things are over the counter, that's how safe it is. For the creams, if you're looking for creams, we have Estrace or estradiol, and then we have Premarin. So those are the two brands. Many times it can be quite expensive, $400, which is ridiculous. Use a GoodRx coupon in the US, or go to the Cost Plus Mark Cuban pharmacy, and it could be about $40 for a tube that will last you, 6 months. And it comes with an applicator. Throw that away. You do not need the applicator, just a little pea-sized toothpaste amount. So for the US, I just wanted to really say what are the options that we have for cream and where you put it. Yes, that's really where you want to put it, because people don't know where to put it. And if you put it in the wrong place, it doesn't work. So watch the video so you can see the puppet, the vulva puppet, and that's really where you want to place it, because that's where you need it. That tissue is really thin and dry, and that's exactly where you want to put it.
Brilliant.
Yeah.
What I was going to say earlier, actually, is ask for a second, just to finish what you were saying, Flamma, ask for a second opinion. Just because one person says, no, you can't have that, no, it's this or this, ask for a second opinion. You are fully entitled to. And actually, I would direct, listen to this, check out Flamma's work, all the courses, the information, the resources. Absolutely. Don't just take what one person says. And there's a lot, I don't normally say this because you can go down the internet rabbit hole on Google search.
Don't do it.
Don't do that.
Don't do it. Don't do it. You can get lost and you can hear some wrong information.
Yeah.
And a lot of sort of like, oh, take this herbal, eat some yams. Like, okay, no, there's safe FDA approved medication. You don't have to just Google every last thing. Go to feminineflamemd.com, watch those free videos. That's just so much information just to start with. And we can do this. It's not that hard. We do really hard things. This is really simple.
And also, you have a YouTube channel. I think you have some information in Spanish too. We did a video in Spanish for women that want to hear this in Spanish.
Yes.
Go to your YouTube channel. Go to your Instagram, Feminine Flame MD as well. There's also a lot of information, but your website, definitely go there, Feminine Flame MD. Check out the information, and listen to your body. Take care of your body.
Viva la vulva.
Viva la vulva. I love it. And it's even.
Thank you so much for having me, ladies. What a pleasure. I love these brilliant, gorgeous flamas. I love it. Thank you so much.
Thank you, sweetheart, for coming on and sharing your time with us, and so many juicy nuggets of information. I love it.
That's the whole point. Stay
Juicy.
juicy and joyful.
Juicy and joyful. I love it. Please
So-
don't. We'll join you in the green room while we just wrap up.
Yes. So that is just so important to take care of your body so you can feel excited and joyful and lively. And she's such a good example of, what impressed me more is, she has lived through it. You see her vibrant, you see her energy.
Radiant.
And so it's like, I want to be her. I'm like, what is she taking? What is she doing to be and feel and be just vibrant and with this energy? So
Love it.
I just love that, it's not a 25-year-old telling me, oh, you need to do this. No, she's living it. She's lived through it. She's thriving, and it's just beautiful energy. So, watch the replay, share the replay. If you are a physician again and want to share this information with colleagues, with friends, with family, please share the video, the Spotify audio. Go to Spotify and rate us. And if you're a physician and you're struggling with anything, you feel like an imposter, you feel that there's some challenges at work and family, in anything, get peer support so that you don't go down the rabbit hole of anxiety, of depression, of leaving medicine, of burnout. So get support before it gets too late. Go to physiciancoachsupport.com to talk to a peer. And again, share this with anybody that may get benefit from this information so you can thrive in menopause and beyond. And Nupi, how can they get a hold of you?
So you can get hold of me on LinkedIn. I'm pretty much always on LinkedIn, actually, but I'm also on YouTube, Instagram, and Facebook. You'll find me under the Glitter Practitioner. Look out at my Live with the Glitter Practitioner show, which is every Monday evening at 8 o'clock UK time, which is 12 noon Pacific Daylight Time. And just reach out. I Find Your Fizz and Flourish coaching one-to-one program. All my links are there, and you'll probably find the links down here somewhere
On the comments.
on the comments. Thank you. From my wonderful, say, Mr. Producer. That was such a good episode today. I loved it. It was so much information in such a nice, tidy time frame. Brilliant.
Yeah, and check out more in depth. Again, there's a lot more. We really just touched the surface because of the time, but go and learn more, ask questions, ask for a second opinion if you need it, but get feeling vibrant and healthy and enthusiastic. And with that, we leave you guys. Thank you for tuning in, and we will see you in 2 weeks at that time, 7:30 a.m. Pacific time. And UK time is 3 o'clock, right?
It'll be 3:30.
3:30. Yes. We'll see you guys.
Bye.